I'm not foreseeing a vaccine against heart attacks. This would be possible when we are convinced that these heart attacks are related to the involvement of a viral disease, like Dr. Epstein suggests. If really the infection burden can be reduced by a vaccination against viral organs and organisms, then we are on the right way to test this hypothesis. But when we on the other side are not convinced that they play an important role, we have to do other directions and we have to go another way. My strong feeling is that we should develop drugs based on our knowledge of the inflammation which is ongoing in the vulnerable plaque. So inhibition of MMP would be one possibility. Others like antibodies against tumor necrosis factor alpha or against interleukin 1 and 6 are ideas which are taken into account and where we have to go and possibly can really lower the risk. That is frustrating at the moment. We as a physician have not really tools to lower elevation of CRP or elevation of fibrinogen. The current drugs are only mild to moderately modulating the levels which we find in our tests. We need stronger drugs to be able to lower the inflammatory response which we detect. It would of course be very interesting when we can do an immune modulation. An immune modulation to change the cytokine production or the cytokine elevation which we find in the interstitium, in the tissue, or even in blood samples. This vaccination would be very helpful in order to reduce the risk of individuals where we can detect vulnerable plaques.